Good morning, everybody. Good morning. Good morning. Today is Tuesday, May 21st, 2024. And you are here in the Java Cafe for what I just decided to call this morning a special edition of Your Healthy Java. For the past maybe almost 2 years or so, I've had the opportunity to see this wonderful queen in community. We are both proud members of Boston While Black. And I've talked here and there, hey, I see what you're doing, would like to get you on the show. And I do believe timing is everything. And finally today, we have her here on the show. And even down to the last minute, there were some logistical things that happened that lets me know that it's important that we check in with our guest today. I am honored to have in community with us in the Java Cafe, Dr. Lucy Lomas, who is a renowned TEDx speaker, a doctor, and she'll tell you about her journey in just a few minutes. But I would like to ask you to get everyone to come in and join us in the Java Cafe this morning. And so before we get ready to get started, I just wanted to say hello to Mama Java, Pastor Marion, MZM, who is in the room. Real Java is in the room, Pastor Marion as well. And so invite others to come in and hear. We're going to get her perspective on where we are with women's health. She did speak to her training experience as a Black woman. And so we'll hear some of that as well. And so as you can see, it's obvious for those of you that are going to start commenting and crying, I am on the road. And so we're not going to have as long today for our UCB members. You're not getting 90 minutes today. But we're going to go ahead and bring in this wonderful guest into the room. I'm honored to have her here. I'm just excited. We had a little pre-convo about women's health, and she said we have a long way to go. And so let's go ahead and check in. I am honored this morning to finally, at my fault a lot, to have the renowned TEDx mom, wife, speaker, Black woman, queen, Dr. Lucy Lomas, she, her. Good to have you in the Java Cafe this morning.
Thank you so much. I'm so happy to be here.
And you sound good and look good. We weren't able to do the sort of pre-testing, and so everything is wonderful. And so please, before you introduce yourself, let's set a little bit of context and leave people maybe on a cliffhanger. You can give context after your introduction. Describe where we are with women's health in one word, then introduce yourself, and then give us the context. That says a lot.
Transition.
Okay. All right. So now I'm talking about leaving them on a cliffhanger. Now I'm sitting here like, let's just skip to the context. No, tell us a little bit of your journey. We got to know you a little bit a few weeks ago at TEDx Roxbury. You presented there, did an excellent job. And so tell us a little bit of your journey, and feel free to fold some of that, into your introduction here. Say hello to the Java Cafe and the family here. You all welcome her in to the Java Cafe. And Dr. Lomas, the time is yours.
Yes, hello. So I'm so happy to be here. Thank you so much, Jimmy, for having me and just giving me the opportunity to kind of like share more about my work and also my ideas about women's health and healthcare in general. So, I think that Knowing that I'm from the South, that I've spent 15 years in Los Angeles and I've been in Boston for the past 10 years is definitely something that I think is important to who I am. Um, I'm a mom. My kids, they're 5 and 3 years old. So if you see me walking down the street in Roxbury, like, please say hello. Um, and also, I'm an OBGYN physician, and I was so happy to share more of my story with TEDx Roxbury. Um, I think that I've always wanted to go into medicine and be an OBGYN. Um, so that was always very clear for me. I always knew that I was going to deliver babies and just be and then so I went to med school residency, and I was just very, very focused on, learning about practicing medicine. And then, you get in the job and you just start working and you just do the
Mhm,
work and your head is down. And I think that is something that a lot of physicians find themselves doing. Like if you're a doctor or a healthcare worker, you find yourself it takes so much time and training to get to the job that you just spend time once you're there focusing on doing the work. And I spent a lot of time just doing that. And then it was really around the time when I had my kids that I started to look around and look for something that was a little bit more fulfilling, and not so mentally and emotionally draining.
mhm.
And that was where, finding myself in community, find myself talking to people and educating them about OBGYN, about healthcare, about wellness. Um, and then I also had to realize and recognize, and this is something that I literally typed into my journal last night. My voice matters, my experience matters, and getting to share that with more people is really important. And that has definitely become more of a priority. Um, so last night I was able to speak on the stage with some of our lawmakers, legislators, Nashira Baril, Dr. Ndidi with the Mother Lab at Tufts. And I was just so grateful and honored to be on that stage and share my thoughts and perspective about women's health, about reproductive rights, about maternal health. And the word that I described, transition, it's because we are at a place where we have acknowledged, well, I'm at a place where I have acknowledged um, a lot of the history and also recognize, we have to take on the responsibility and take accountability to create the healthcare system into something that we want to participate in, engage with, and receive care from.
It is, so interesting to hear. One, when you mentioned that you were from different parts of the country, I don't know at what iteration of your training experience those years involved, but to me, that said that you have a good purview into things. If any of your training was during those different geographical locations, you've been on the East Coast, you've been on the West Coast, you're from the South. And so it gives you a real good perspective to speak to sort of the training experience you talked about and just your observations from your training experience and then being a fully, accredited physician. One clarifying question. I thought when you mentioned that when you had your children, that may have been a transition point because you went from provider to patient. And I don't know where that experience, well, let me just ask you plainly, how did that experience clarify where we are in women's health? Uh-oh, I can tell by body language so how did that experience inform your perspective then and now as to where we are with women's health? And then feel free to sort of go into, we can do this as a grand rounds or lecture approach. But where are we and what's important to you when it comes to women's health? And so that was loaded and packed. but I'm sure you can handle it.
Okay, you've brought up many things. I will do my best to address what I recall. Okay, so you're right when you speak about my exposure to
Mhm,
how medicine is very different across the country, like within the United States, just regionally, um, down south. So, my sister had her baby last year, and I had the pleasure of getting to support her during her pregnancy and her delivery. So, this was last year, and she had heard and had certainly been doing research about maternal mortality rates. And right in Massachusetts, the maternal mortality rate is 2 times that in comparison to white women. But in Louisiana, it is worse. So she went in with a lot of concern and fear for her life and her safety. And I was able to bring hopefully some peace, some calm, and some comfort and confidence. And not only did she have me, she elicited the help of a doula. She had my sister, who is a NICU nurse. So she had
Can we
literally,
tell folks what the NICU is? The
okay, yes, thank you.
Neonatal Intensive Care Unit. That's where the babies go if they're very premature or have at birth complications.
Correct. So NICU, Neonatal Intensive Care Unit.
Yep.
So they will take care of really babies that are maybe born very early, babies that have difficulty breathing, um, babies that just need some sort of additional help or assistance, right? Okay. So that was the team that my sister brought together, and the her her feedback after her delivery was so meaningful and important and inspiring to me. She said after her delivery went beautifully, she did amazing.
Yep.
Um,
Yep.
she said, I felt taken care of. And I think that is beyond important because when we feel taken care of, there's low stress, right? We feel comfortable. It just allows our body to function the way it is designed. Our bodies are our bodies are created to carry our pregnancy and birth our children normally and naturally. That is actually something that I have believed in. And perhaps it is because during my training, I had the pleasure of working with a lot of midwives from very, very early in my training. So I'm certain some of their philosophies absolutely rubbed off on me. And, we were, as residents, as early young physicians, right? We were a little bit resistant sometimes. And also, I was able to like really receive the good information that they shared. But like our body functions the way it is designed. And when we are calm and relaxed and we feel taken care of, guess what? You will be able to carry your pregnancy. You'll be able to birth your baby without complications. And not always, of course, not always. I just want people to know that pregnancy and childbirth does not have to be this scary thing, right? Like when patients come to my office, one of the first things I say is, you are not ill, you are not sick, you are just carrying a baby. And we have to really listen to our bodies so that we can understand what our bodies need. And right now, we need to slow down and we need to rest.
So you're good. You're a good guest because as you're talking, I was thinking. No, honestly, I was thinking of asking, and you covered about three of the maybe eight things that I put in that last question. So I'll try to just keep one or two here. You're OB doctor, oh Jesus,
Obstetrician and gynecology. So
obstetrician and gynec. I was going to
OB,
say obstetrics,
OBGYN.
OBGYN,
Yes.
obstetrics. Obstetrician is what you are. Obstetrics is the
The
department,
practice?
the practice.
Correct.
Okay, I just told you I've been out of the fellowship of medicine for a few years, so I'm a little rusty. But you that is the area that you move in. But you also talked a little bit of mental health. Of We know that good mental wellness is a part of health, and so especially when you are carrying a child, when you are getting ready to give birth to that child, and so if I could sort of take us back a little bit for women and those that are able to birth children, um, if they make that decision to proceed with that, that is their choice and their decision. I'm sure you're more than aware, one is a woman and someone that moves in that specialty, that things are interesting right now for women when it comes to, you talked about their bodies and what they're made to do. And so, could I also ask your perspective um, just around how women um, have rights to their bodies and to make decisions from pregnancy not to being informed and demanding from providers screenings and if there are issues. I'll stop because I'm going to do another 8. So go ahead.
So, you know, my perspective about health is truly holistic. And when we think about health, we need to think about our physical body, mental wellness, emotional wellness, and spiritual wellness.
Mm,
Mental wellness includes all of the things that we think about or all the things that might keep us up at night. So that could be your finances. That could be, do I have a safe place to sleep? Do I have enough food to eat? That could be the stress from um, working in an environment that perhaps is, you know, stressful, where people may be experiencing racism or microaggressions um, on a regular basis.
mhm,
And that is just for the mental wellness. And then, we talk about, all right, well, how does that show up as anxiety, depression, psychiatric disorders, etc.
mhm.
Um, and it's basically like everything that your brain is thinking about. And that could be like many, many, many things. So we also have to understand, like, how does the brain impact the body, right? So our brain interprets, incoming signals or stressors, and that will cause the release of stress hormones that will
Mhm.
activate your autonomic nervous system, um, and it will also cause inflammation.
What is autonomic nervous
Autonomic
system?
nervous system. That's the nervous system that you do not have control over. So the
Autonomic. Okay.
autonomic nervous system, that's the part that you do not have control over. So it is comprised of your parasympathetics and your sympathetics. So, for example, you need your parasympathetics to relax, rest, and digest. Okay. The sympathetic nervous system is designed for the fight or flight. Okay.
Okay.
So if you are, so to rest and digest, that is also responsible for your digestion. So we actually need to rest to digest our food and process the food that we eat properly. But we may need our sympathetic nervous system activated when we have to um, when we are responding to the cell phone dings. A
Mhm.
lot of things can activate our sympathetic nervous system. I'm not doing a really good job explaining this. I have done it better before, and you asked me the question, so I ended up going off
No,
into.
you're good. You're good. Listen, we're used to Mayor Wu comes on sometimes, and what I say about her is you have all this knowledge and the intersectionality, it just hits and it just comes out. And so a couple of things there is I had a young lady on Sister Jera through Pure Spark with Naisha Deed. And so what I've learned in the past couple of weeks that we have a central nervous system, which now in real time I'm realizing that's the central nervous system. Then there are sub nervous systems. You just named one, and she named one. that had to do with meditation and what meditation does for that sub nervous system. So we're learning a lot here. So you're doing fine. And I need to maybe ask the questions. Oh, wait a minute, hold on. Belinda just said that it's a good question. So I'm not doing too bad. Dr. Loomis, we have to take a break. But you know what? You got me right at TEDx. Am I saying Loomis?
Lomas.
Lomas, I got it. Okay.
Mhm.
We got to take a real break, but my mother is in here saying very great responses. She's saying you have a very soft voice and loving concern. And then here's Belinda. Are you taking patients? Because we need more gynecologists. And so we're going to provide her IG information in just a few moments. But while we're talking about women's health, we're going to take a quick break and make sure that you understand that there is healthcare available to you. We understand that Black women right now are the number one demographic when it comes to entrepreneurship. And so the Mass Health Connector has this option for you to apply for healthcare. Here it goes right here. We'll be back with you in just a few moments.
For the innovators, the dreamers, the risk takers, independent workers who keep our neighborhoods thriving, Connector Care from the Massachusetts Health Connector has plans for every lifestyle and budget.
Having access to affordable healthcare is for everyone in our community.
Connector Care plans help more people save on healthcare that covers all their needs. Find out if you qualify for Connector Care. Visit mahealthconnector.org or call 1-877-MA-ENROLL.
Listen, everyone, we're talking women's health with Dr. Lucy Lomas. And we went out there a little bit. And so I think we definitely need to have another segment. I want to let you sort of finish sort of that purview of where you see things. You did cite earlier that your sister had an experience that she felt taken care of. That was important. And you were just talking about the impact of like mental health and what that does for us. And so we're going to get ready to start wrapping up, but I also wanted to additionally ask you, where do you see us going? You mentioned that transition was your word. To me, that says that we are actively, you mentioned there's acknowledgement of some of the, I forgot the term that I used. That'll come up in a second. Some of the history and the past when it comes to medicine in general. Specifically, there are well-known practices that the way they came to be was not the most humane way of treating. I know at least of two Black women that contributed to gynecology, and also Sister Henrietta that contributed to, and you'll tell me,
Henrietta Lacks.
yes, and her contribution. And so that's where we were. You gave us a good peer view to where we are. If you had a magic wand, if you had the ability to equalize medicine, I would say across the board, but I'll make it more specific so I'm not way out there. For Black women, Black and brown women, where would you like to see it go?
You know, I think people should feel taken care of when they go to the doctor's office, when they go into the hospital, when they go into the emergency room, when they go to labor and delivery, if they have a small procedure or a big procedure. I think people should feel taken care of. I think our healthcare system is very complicated for an assortment of reasons, right? Like we have so much research that is being done specifically in and around Boston that the doctors are often incentivized to like specialize and then subspecialize. And then you have to find yourself in the right clinic on the right day and with the person that knows someone else. It is very complicated to navigate.
Mhm.
And we just have to like be more open and upfront about what that is so that, each physician is not a one size fits all. That's just not how it is. And, and that was something that I had to recognize it's like as much as I wanted to help every single patient that came into my office, um, with more of the shared decision making and with taking a little bit more time to educate people about what the concern is, what are some of the potential options, what works for your lifestyle and your desired outcome.
Mhm,
Um, and that was also very freeing on my end, but also like empowering to the patients, um, to help them be very more involved in their decision making. And I think that is also going to require a bit more of a culture shift. And I think that's definitely shifting and changing. I see that now. Um, and we as patients, as community members, as healthcare advocates, we get to say that is what we want, that is what we need.
mhm.
Um, so I am currently working with Upham's Community Health Center, where I am practicing some gynecology and seeing a few patients that need procedures. And I am not doing absolutely everything OBGYN right now.
Okay.
I am super excited about what is possible and different ways that I can help in the healthcare system move
Mhm.
in a more positive direction. I'm very excited about that. Um, I am the executive director of New England Medical Association, and that is our
With Dr. Elena?
yes,
I didn't know you was the ED.
yes.
Okay. Go ahead, sorry.
Um, so with NEMA, the work that we are doing is to diversify the physician and the healthcare workforce.
Yep.
So we get to work with our lawmakers and legislators. We have a bill right now where we want to publicize the demographic information for your physicians. And with more of those conversations that we are having, we realize and recognize we need more information, not just demographics of our doctors, but everybody within the healthcare system. Do you
Of
have a
course.
question about that?
Well, but my thing is that it we need their demographic, but we also what we
Okay.
found out prior to 2020 and others is sometimes when this cancel culture comes up, when people are captured on video saying racist things, and I'm going somewhere with this. Oftentimes, those videos make it to the person's employer. And folks like you and I start to ask questions. What if this person was an approving official for a scholarship for a black or brown person? What if this person was the hiring manager for a very prominent position? What I'm saying is not only the demographic information, but is there a way to find out? Um, well, you can't. I don't know how you can measure morals and values, but sis, with all due respect, doc, I'm sorry, doctor, that there needs to be a database on that too.
Okay. So that's your healthcare. Wait, that's your world magic wand, morals and values. Absolutely, I'm all for it. Um, especially as I see this steward healthcare crisis unfold in front of us, and um, you know, we how do we encourage businesses to act morally? And I think that's just the question. I think like maybe that's why we see more black women business owners, entrepreneurs, right? Because that is, for me, that is definitely a priority, right? I don't want to harm intentionally or inadvertently. Do you know what I mean?
I do.
So it's just like I want that magic wand also. Um, but like I was saying, working with NEMA, getting to support the health and well-being of our doctors
Hmm.
so that when you go to your doctor's office, you see more people that look like you. That shows that when there is concordant care, right? Doctors and healthcare workers that look and reflect you and your lived experience, there is more trust and more likely to have adherence and compliance. But I imagine this is not just about compliance, this is more about the shared decision making. Um, you know, we have to acknowledge racism is at the core of modern medicine and our healthcare system. And we just all have we have a lot of work to do. So
The transition, that was what you started with when we were talking a few minutes ago. There's a lot of work to do. You named that we were in transition. And I just have to also name my appreciation, because we've touched on a couple of topics that I know are very sensitive and you're passionate about. And to my mother's comment and point, I noticed that even when you addressed it sternly, it was in a very calming manner. So I just want to name that. Can we also, before we get ready to go, can I name what I'm aware of as the typical encouraging screen? We encourage women to get screenings and care. And so we know that it's important that women get and do self breast exams. We know that it's important that they get mammograms. We know it's important that they get their regular pap smears. We know that it's important that they also are able to name that they feel safe. That's a part.
colonoscopies.
Colon. So you and Doctor, Joe Betancourt. It's
I
so
know
interesting.
of him.
Yeah, it's so he's been getting well. I'm not going to open up myself to you to give any commentary about me and my colonoscopy. So yes, because that's a focus often you hear. Maybe because I'm a man, but you don't hear by my observation. You don't hear that as much for women. Am I right? Are you aware of I don't hear it a lot. And now I'm not in women's health. I'm not a woman, so maybe, but I don't in the public health world, I don't see a lot of encouragement for women to get their colonoscopies. So that's why I said the typical things. You're now enlightening us that colonoscopy is another one. Are there more? And feel free to give any context for what I just mentioned about not hearing.
Yeah, the recommendation, as far as I know right now, is Black people are supposed to start getting their colonoscopy at age 45.
45. They just, yeah. So that's male or female, or wherever you identify on the spectrum. Okay.
I'll tell you, I'm scared.
Because we're behind, or you as an individual?
As an individual, because I don't, that's...
Dr. Lomas, let me keep it 100. So I found out a couple of years ago that I was 5 years behind because they changed the criteria. Yeah. And so Dr. Betancourt, I had a health fair a couple of weeks last week. And the colorectal department from MGH was there. And so they were there last year. And they were there the year before. And so she looks at me and she says, so did you get your colonoscopy yet? And I was like, so Dr. Betancourt walks up to me and says, I have a wonderful show segment idea. We're going to follow you through the process of you scheduling your colonoscopy and where with HIPAA and, I want to be as transparent, end results or just the process of the procedure. And so that is coming, Dr. Lomas. Yes. So thanks for the reminder. So colonoscopy, is there anything else that we're not, you're aware of that we're not making our women aware of as far as screenings?
So one of the things that I have the pleasure of doing is working with some of the community groups and working with the library to do these health education, integrative health sessions and workshops. One of the topics that I have done is on healthy aging. And this particular topic, there are so many different ways to focus on aging. But basically, I do like a brief overview of, the chronic health conditions that impact our senior senior population. I put that in quotes because
Yep.
who's aging, who's senior, who's elderly, golden, silver? Listen, I don't know.
We got a few golden girls in here, so it's so apropos that you're talking about this. I have a whole mother's board in the
Yes.
Job Cafe. So please,
But
this is
there's a whole, like, I have a whole, it's like a whole page of screenings. Like, you have to get your DEXA scan, you have to get screened for depression and anxiety, you do the colonoscopy, the mammogram, like there's like a whole page. So, but these are the screenings that are recommended. We are assuming that you're getting these with your regular scheduled annual visits. It's a lot.
it's a lot. And also let's take into consideration there's part of our population working 2 and 3 jobs. They have children
Yes.
that, you know, and so it is, we are transitioning. And I would also say that um the level of non-trending hype, cliche of self-care and prioritizing yourself, I think that is changing as well. It's now this real sort of solid, make long-term realistic plans. I'm speaking for me, that you can stick to and not do this. You know, we hear things and we hear whatever, and we get hyped for about 2 weeks, and we're drinking water. I'm drinking water and whatnot. And then after 2 weeks, life happens and you realize you had 2 cups of coffee and a soda that day. You know, so
I
there,
I agree. Like, you're definitely speaking one of my love languages right now, simply about self-care and
yes,
how do we really prioritize our holistic health and well-being on a regular basis. Um, and really paying attention to how is our body functioning right now? What kind of self-assessment and evaluation tools do we need to take a look at and give ourselves some time to do the introspection? And I think as we continue to do more of that, then we are going to soon realize and recognize what is working and what is not working.
mm,
But once again, practice listening to our bodies because there's a lot of information there.
all right. This was good. I just want to make sure folks have LUCYLOMAS on IG. I want to make sure folks have your information so they can go follow you. I encourage you. You need to do like you need to do, and we can figure it out, a IG live or a reel or something like once a week. I could really see you doing that and just going live and giving an update and just conversing with the audience, because this one, yeah, you definitely have a cadence about you that even I know at times as a doctor you've made had to break bad news, and so the way that you do it, we hear your intentionality about shared which, okay, I'm not going to go there. It's 9:42. But shared decision making around your healthcare, like the priority should be the patient. Well, but maybe it's dual. The doctors are trained to have the information. It's the patient who's being cared for, and so we hear the shared um, decision making in the healthcare as well. But you would be, if you don't do it, maybe we'll figure out a way to do a little collaboration or something, because it's needed. It is really needed. The fact that we have 130 people on average, that about 85 people stayed in here consistently and listening to you about women's health, and it's not just all women, says a lot. Says a lot. There are sons and brothers and uncles and nephews and godsons that care about their, you know, mothers and aunts and sisters and all right, you don't got me off on a tangent. Folks, please go and follow Dr. Lucy Lomas over on IG. Yeah, timing is everything. And this was the time for you and I to do this. And so I really appreciate it. Folks walked away with a lot and learned a lot today. I just want to share a couple of comments with you. Folks, you really promised folks about, I promise, I'm reading the comments and saying them. You really encourage folks to get their colonoscopy.
Fantastic.
Yes. Lasagna says that a lot of those screenings are not being done at the PCP. And so maybe at some
Thank you for
point,
bringing that up. Like, you know, The United States Task Force on Preventative Medicine has a list. You can look it up online and bring it to your doctor.
That information, and you go in there informed as a patient, one or two things are going to happen. Your doctor's going to be like, oh, okay, let's go.
They're like, oh, we're taking this seriously. That's right. We're taking our health. We take our health seriously.
And it should be the norm. That should. All right. Dr. Lomas, I got to get off of here. I'm a little bit over time. Let's figure out how to do something again soon. And I would like to maybe, at one point we were talking about a panel, but I would like to really do that in person and maybe bring a couple of providers, do a little mini health alley or something. We can partner with NEMA, you, and let's do that. And it doesn't have to be March, just Women's History Month either. Let women's healthcare is important now. All right, I'm getting ready to get off because you know there's
everyone's health is important every day of the year.
So I was going to say my little statement needed to be
okay. Go ahead.
No. You're fine. You're the doc. So no, seriously, doctor, thank you for being with us today. I'm sure you encouraged a lot of people to heighten and prioritize their health just a little bit more, not just women, but men too. So I appreciate it.
Thank you so much.
Thank you so much for being with us. Folks, listen, if you tuned in late and did not get to hear all of Dr. Lomas's presentation today, go follow her on IG and go back and start this episode over. Oh God, I got so excited. Hat and everything is crooked and just anyway. Tomorrow morning we are speaking with Tai Court Odema. I remember that without the flyer. She's coming on tomorrow morning. As you know, she ran for school committee. I believe it was outside of Boston. She ran for school committee. She's coming in at 9:00, and then at 9:30, Yvel Joseph, who is the head coach for the Road to Wellness, is taking place in September. He will be with us in the 9:30 hour. Thank all of you that tuned in today. I want to give a special shout out to folks that are listening over on Twitter and IG. Twitter is lit right now. Most of these numbers that y'all see right there are coming from Twitter. So shout out to everyone from Twitter. Please feel free often to retweet this. If you have not followed Java with Jimmy, go ahead and follow us on Twitter and Instagram as well. Welcome to the Java Cafe for those of you that are with us for the first time. I think that's it for me today. We'll see you guys tomorrow morning at 9 a.m. I don't think I have any other announcements. That's it. Everybody have a great and good day, and we'll see you tomorrow morning at 9 a.m. as we chat with Tai and also Yvel. Have a great day, everybody. Peace.